In this week's class, we will cover the contents of physical activity assessment and epidemiology research. First, I would like to reinforce some key definitions and concepts regarding physical activity assessment and epidemiology. The terms physical activity and exercise were used interchangeably in the past, however, we know now that they have two distinct meanings. Physical activity has been defined as any bodily movement produced by skeletal muscles that results in energy expenditure and includes activities of all intensities. Therefore, things such as housework, gardening, and occupational activity may all be considered types of physical activity. Exercise is considered a subcategory of physical activity and has been defined as planned, structured, and repetitive movements which result in the improvement and/or maintenance of one or more facets of physical fitness, such as cardiovascular fitness, muscular strength, and endurance, body composition, and/or flexibility. Therefore, all exercise is considered physical activity. However, all physical activity is not exercise. As a result, physical activity intervention efforts should focus on increasing total physical activity and not just at increasing exercise. In addition, as I mentioned before, the occupational activity, household chores, gardening or yard work, and sports belong to the category of physical activity. Here I want to clarify the similarities between physical activity and physical education. Physical education refers to a course taken during primary and secondary education that encourages psychomotor learning in a play or movement exploration setting. In physical education class, there can be a variety of physical activities, such as exercise and sports. Sports is defined as an organized, competitive, entertaining, and skillful activity requiring commitment, strategy, and fair play, in which a winner can be defined by objective means. The figure on this slide clearly demonstrates the relationship between physical activity and physical education. Any questions? Next, I would like to talk about energy expenditure and energy balance. Total energy expenditure is the total amount of energy, typically measured in kilocalories, that is expended over a specific time period, usually measured over a 24-hour period. There are three major components of total energy expenditure. These include basal metabolic rate, thermic effect of food, and physical activity. The percentages provided in the slide are estimates that are typical for a sedentary individual, and these estimates will vary based on an individual's physical activity status. For example, the contribution that physical activity makes to total energy expenditure is greater for active individuals compared to their sedentary counterparts. In detail, basal metabolic rate accounts for approximately 70% of total energy expenditure. It refers to kilocalories your body needs to properly function while at rest. Thermic effect of food refers to kilocalories your body uses when it is digesting food, and explains approximately 10% of total energy expenditure. Physical activity accounts for approximately 20% of total energy expenditure, and it is the most variable component of total energy expenditure and is divided into two main components. Activities of daily living such as bathing, eating, and grooming, and variable activities such as sports, leisure, and occupational physical activity. Here comes the content of energy balance. Ensuring optimal health and maintaining a healthy body weight is accomplished through sound dietary practices and participation in regular amounts of physical activity. Energy balance is the difference between the number of kilocalories that you eat energy intake and the number of kilocalories that you burn energy expenditure. If energy intake is greater than energy expenditure, then you are said to be in positive energy balance. An individual in positive energy balance will gain weight. If energy intake is less than the amount of energy that is expended, then you are said to be in negative energy balance. An individual in negative energy balance will lose weight. If energy intake is equal to the amount of energy that is expended, then an individual will maintain his/her weight. Well, I also like to differentiate exercise and lifestyle physical activity. The term structured physical activity is simply what comes to mind when we think of exercise. It consists of planned bouts of physical activity and is oftentimes more straightforward to describe, in terms of intensity, time, and/or frequency than unstructured physical activity. Lifestyle physical activities are bouts of physical activity that are incorporated into an individual's everyday routine. Lifestyle physical activities are often considered unstructured because they vary based on events and/or situations that develop over the course of a given day. A few examples of lifestyle physical activities include taking the stairs instead of the elevator or escalator, parking the car further away in store parking lots, walking around the home or office while chatting on a cordless telephone, etc. Similar to structured physical activity, maintaining an active head, by making active lifestyle choices where possible, will also help improve one's health. Alright, next we will cover physical activity assessment. First, measurement concepts will be introduced. When physical activity is measured, the frequency, duration, and intensity of volitional physical activity performed at some period in the past are studied in relation to their impact on health. Frequency relates to the number of times per week or year that one is physically active. For example, according to ACSM, the minimum frequency of vigorous exercise needed to increase cardiorespiratory fitness is 3 days per week. Duration refers to the time spent in a specific activity as hours or minutes per session. Research is variable in what is termed short, middle, and long duration physical activity. In one study, physical activity was measured in minutes per day and categorized into 3 time periods described as short, like 15 minutes a day, middle, like 47 minutes a day, and long duration, like 133 minutes a day. Research suggests that at least 30 minutes per day is the recommended duration of activity to reduce the risks for premature morbidity and mortality. Intensity refers to the difficulty of an activity and is generally classified as light, moderate, or vigorous in epidemiologic settings. Intensity may be expressed in absolute and relative terms. The recommended unit for intensity in absolute terms is the metabolic equivalent, or MET, which is defined as the ratio of the activity metabolic rate to the resting metabolic rate. 1 MET is approximately equal to 3.5 ml per kg per minute of oxygen consumption. Relative intensity measured include the percent of maximal oxygen uptake or maximal heart rate, or rating of perceived exertion. Dose refers to the combination of the frequency, intensity, and duration of physical activity and is expressed as kcal per day, MET hours per day, or other units.